Welcome to Be Air Aware. Over the next half hour, we will be talking about air pollution. What is air pollution? How does it affect our health? How can we measure air pollution? What do we do with that data? And then we will focus more specifically on the Air Quality Health Index, which is a tool available to help manage your exposure to air pollution. Air pollution is basically dirty air. Air quality is degraded when unwanted chemicals or other materials are released into the air in large enough amounts that they can damage materials like the Parthenon here. They can damage the environment. Here we see ozone damage to the leaf on the right, or they can damage our health, as is the case of smog. The quality of the air depends on the amount of pollutants, the rate at which they're released from various sources, and how quickly the pollutants disperse. A case in point would be in 1952. It was a very cold December that year, and people were using coal fireplaces to combat the cold. However, this was in combination with a temperature inversion over the city that lasted for 5 days, so it trapped air over the city. The air was stagnant, and over that time, combustion products from the coal were building up in the air, resulting in what was known as a killer fog. It was estimated that there were 12,000 deaths from this buildup of air pollution, and this event actually led to the initiation of the Clean Air Act. So air pollution can clearly affect our health. What is it that it can do? Health Canada has calculated that air pollution is estimated to cause approximately 6,000 premature deaths per year. And there's an extensive body of evidence that links the exposure to outdoor air pollution and health effects. These effects can be the result of short-term exposure or long-term exposure. In terms of short-term exposure, we're looking at exposure in the range of hours, days, or weeks. The effects of short-term exposure include exacerbation of pre-existing respiratory diseases such as asthma or COPD, and also of pre-existing cardiovascular diseases. You may see an increase incidence of cardiac arrhythmia, respiratory inflammation and irritation, and decreased lung function. Long-term exposure is in the realm of months to years. Long-term exposure to air pollution is associated with increased mortality as well as incidence of lung cancer and pneumonia. It is also related to incidence of cardiovascular disease, such as the development of arterial sclerosis. Although we previously understood that air pollution led only to the exacerbation of asthma, like in short-term effects, it's now more evidence is available suggesting that long-term exposure to air pollution can lead to the development of new asthma, and it can also delay or impair lung development in children. So with all these health effects of air pollution, how do we monitor air pollution? Well, contaminants are measured in one of two ways. Either through continuous real-time monitoring or non-continuous or discrete monitoring. In continuous monitoring, air is constantly measured and the data is automatically transmitted to a central database, whereas in non-continuous monitoring, contaminants can be collected maybe on a filter or in a canister for a specific period of time, so perhaps for 1 to 6 days, and then a technician collects the filter or the canister and sends it away to for analysis. There are lots of techniques available for analysis of the sample. An example might be that air collected in a canister in an urban environment could be analyzed for volatile organic compounds. You would anticipate these compounds in an urban environment. They're part of vehicle exhaust, and there are over 160 volatile organic compounds that you might test for. So collections of measuring instruments are usually housed in monitoring stations, and they can be in urban regions like the monitoring station pictured at the top of this slide, or they could be in rural locations like the station at the bottom of this slide. And these stations are often, the data from these stations are used together in networks. So here we're looking at an example of one of these networks. This is the National Air Pollution Surveillance Program Continuous Monitoring Network in Canada. This network was established to assess the quality of outdoor air in populated regions of Canada, and it continues to provide us with accurate long-term air quality data of a uniform standard. Information from this monitoring system can also be used on a global scale to help Canada meet its international commitments to tracking changes in the atmosphere. So how is all this data that we've collected being used? I'm actually going to talk about 3 ways that the data we collect is being used. And the first is a longer-term use on a national scale, and that's in the Canadian Air Quality Management System. And this is a comprehensive approach for reducing air pollution in Canada, and it's a collaboration between federal, provincial, territorial governments. You may be familiar with the Canadian Ambient Air Quality Standards, or the CAQS. These standards are established as objectives under the Canadian Environmental Protection Act, and provinces and territories implement actions to help achieve these standards and maintain our air quality. There are also several mechanisms in place where this data can be used. It can be used in air zone management, which is more of a place-based approach to managing local air quality. It can be used in airshed coordination, so an airshed may contain many air zones, and it's usually geographically defined, so perhaps a mountain valley. We also have industrial emission requirements, which the data can be used towards, but the industrial emission requirements can be quantitative or qualitative values, but these requirements are to ensure that regardless of where an industry is set up, it will meet a good base level of performance for Canadians, and we also use the data to monitor mobile sources and continue to improve emissions from those sources. Another way that this data can be used is perhaps on a provincial scale, and that might be to address air quality advisories. So in British Columbia, air quality advisories are issued by the regional offices of the Ministry of the Environment and by Metro Vancouver on behalf of many agencies who are in partnership here. Advisories are issued when pollutant concentrations approach or exceed a predetermined limit, and are expected to continue or to worsen. And then the advisory is ended when the pollutant concentrations fall or are expected to fall to more normal levels. They are issued in order to help people make informed choices about reducing their exposure to elevated concentrations of air pollutants, and are usually based on data for a 24-hour period. An advisory can also be issued to implement a local or regional burning ban if you know the potential for seriously degraded air quality has been identified. And then the last thing we use the data for that I'm going to talk about of the 3 things is the Air Quality Health Index, and this addresses the short-term acute health concerns. We had mentioned earlier that approximately 6,000 premature deaths in Canada per year as a result of air pollution, and it's estimated that exposure accounts for 70% of these deaths, so there is a need for a tool that can help empower individuals to take action to protect their health, and that is the goal of the Air Quality Health Index. You may have heard of a more traditional air quality index. The Air Quality Index is based on a single pollutant, and it's a threshold value. You're either above it or below it, which may or may not be based on a health data. And it's provincially derived, or it was provincially derived, so that means that it's not really consistent across the country, and everyone sort of had a different way of calculating their air quality index. And so the Air Quality Health Index aims to come up with a more consistent method of identifying air quality on a national basis. The pollutants that exhibited the most consistent association with mortality data, and this data usually comes from large urban areas, those were the ones that were selected in coming up with the calculation for the air quality health index. And as it turns out, there were 3 pollutants, nitrogen dioxide, ground level ozone, and particulate matter, that had the most consistent association with mortality data. So these pollutants are all used in the calculation of the Air Quality Health Index. So unlike the traditional AQI, the Air Quality Health Index has more of an air pollution mixture approach instead of a solitary air contaminant. Nitrogen dioxide is produced from burning fossil fuels. It contributes to acid rain and to smog, and it is the component that gives that reddish-brown gas look to smog. Breathing air with high concentrations of NO2, it can irritate airways. Over short periods, it aggravates respiratory diseases, particularly asthma. And it's also thought to magnify allergic reactions. So this research was done on asthmatic subjects, and it was found that asthmatic subjects who were already sensitized to an allergen in the presence of NO2, the bronchoconstrictor effect would be magnified in these subjects. Over long periods of time, exposure to NO2 may result in the development of asthma, as well as potentially an increased susceptibility to respiratory infections. Of particular note with nitrogen dioxide, this is nitrogen dioxide itself is a primary pollutant in that we produce it through combustion, so you'll see it in car exhaust. But it is also a component in the creation of secondary pollutants, such as ground level ozone and particulate matter, both of which are contaminants used in the calculation of the Air Quality Health Index. So ground level ozone is a secondary pollutant. It is produced when nitrogen oxides and volatile organic compounds exist together in the presence of heat. In this case, the heat is sunlight, and we get the creation of ground level ozone. It's definitely a component of smog, and you can see how on a warm, sunny day, as the level of traffic increases, the level of ground level ozone will also increase. The ground level ozone interacts with proteins and lipids, and it can activate stress signaling pathways. And this can lead to airway inflammation, which may ultimately result in scarring and permanent loss of lung function. So airway inflammation is actually an under-recognized risk factor for cardiovascular disease. There is a lot of evidence now suggesting that the inflammatory mediators that are produced during airway inflammation can actually spill over into the bloodstream and induce systemic inflammatory response. And basically, the mediators released in the systemic inflammatory response can make arterial plaques more vulnerable to rupture and lead to other vascular events, including the potential for heart attack. This inflammatory response is not restricted to ground level ozone. You also see it with particulate matter. Particulate matter was the final air pollutant included in the Air Quality Health Index. When we think of particulate matter, we think of dust, smoke, sand, pollen, mist, all of these things. It can actually be a primary pollutant, or it can be a secondary pollutant. We tend to think of it during agricultural operations or combustion or construction or demolition. That tends to be when we think of particulate matter. It can affect our airways in 2 ways, either through obstruction or through inflammation. So in the past, a lot of research focused on PM10, which is particulate matter with a diameter less than 10 micrometers. And this was because not only could you inhale this fraction of particulate matter, but this fraction of particulate matter was small enough to reach into the bronchioles. More recent research has focused on PM2.5, which is particulate matter with a diameter less than 2.5 micrometers, because it's this fraction that can reach into the alveoli and potentially into the bloodstream. So in each case, you have a chance for obstruction of the airway or the instigation of an inflammatory response. So we're going to basically, we're going to take a step now into the practical application of the AQHI. We've learned a little bit about what air pollution is, how we measure it, what we use the data for, and we've talked a little bit about the pollutants that are part of the Air Quality Health Index. But how do we actually use the index? So in the next section, we're going to be walking through how you can access the Air Quality Health Index online and the different steps involved. So you can access the Air Quality Health Index on the Environment and Climate Change Canada website. So the website's www.ec.gc.ca/Air Quality Health Index. You will have a selection of icons. You can learn about the AQHI, what it means to be at risk, and if you select your local Air Quality Health Index conditions, it'll take you to a map of Canada. There are over 100 communities in Canada that now have an Air Quality Health Index available to them. So you can select your area of interest, in this case British Columbia, and drill down to find the location closest to you. In some cases, you will find it directly on the map of British Columbia, and in some cases, like Vancouver and the Lower Fraser Valley, you can keep drilling down into a smaller area, in this case Metro Vancouver, the Northwest. And now we come to the page where the majority of the information that we're going to be looking at is located. So here you're going to find current hourly AQHIs listed, and so I accessed this on October the 13th and the AQHI was 2. You are also going to find forecasts for today, tonight, and tomorrow. Listed on this page. If you want, you can click on the next 18-hour button and it will actually give you individual AQHI values forecast for the next 18 hours. The level of health risk has been illustrated with colors and numbers on a scale of 1 to 10, the greater the number, the higher the health risk, and in the colors from blue to red, red being the higher health risk. The index readings themselves are actually divided into categories to help better describe the level of health risk. So index 1 to 3 is a low health risk, 4 to 6 is a moderate health risk, 7 to 10 is a high health risk, and 10 plus is considered a very high health risk. And the labels are intended as a guide or an aid, and to find out exactly what they mean, you can click on the health messaging button. And here we're seeing a table showing you health messages for the different health risk categories. Now, the tables are intended to provide advice about how to reduce exposure to air pollution, and advice is provided for the at-risk population or the vulnerable population, as well as the general population. The at-risk population is considered to be people with existing respiratory or cardiovascular conditions. So we talked about some of these. That would include asthma, chronic bronchitis, emphysema, lung cancer, but also people with cardiovascular conditions, as well as people with diabetes, since they are more sensitive because they're more likely to have cardiovascular disease. We also include in this category young children because they tend to spend more time outdoors, they tend to be mouth breathers, and they tend to breathe in more air per kilogram body weight than an adult, so they're getting greater exposure. The elderly are included because they generally have weaker lungs, heart, and defense systems, but they may also have undiagnosed respiratory or cardiovascular health conditions. And then finally, we also include active outdoor population. So those are people who participate in sports or strenuous work outdoors. They tend to breathe more deeply or rapidly, so they get more air pollution entering their lungs. If you don't fall into one of the at-risk populations, then you are likely under the general population. And so just taking a quick look at the table, if you were to look at the high-risk health risk with an air quality index of 7 to 10, the health messaging for the at-risk population is to reduce or reschedule strenuous outdoor activities. Children and the elderly should take it easy, whereas the general population, you should consider reducing or risk scheduling your activities, especially if you experience symptoms. And we'll be talking about symptoms shortly. So how are you intended to use the AQHI to self-monitor? Well, the idea is that you will go online and you will check to see what the current AQHI value is. And then you will check and see what the health messaging is. And then you'll stop and do some self-monitoring. And by self-monitoring, I mean whether you are in the at-risk or the general population, you're looking for more frequent signs and symptoms that might be related to exposure of air pollution, such as itchy eyes, increased coughing, you may or may not have mucus, you may have trouble breathing or start wheezing, especially when you do more activity. So if you see more of these signs, or if perhaps you already have an existing respiratory or cardiovascular condition, you may see that you're having an increased use in your medication. You will try and identify at what point on the AQHI scale this occurs to you. So perhaps we have an asthmatic, and they have identified that when the AQHI is at 6, their asthma starts to act up, they're having more difficulty breathing, and they tend to have to use their inhaler more often. And after a week or two, you should get an idea of how the AQHI works for you. And the idea is that that person, this asthmatic that we have as an example, they'll be able to go look at the forecast for the AQHI, and then they'll be able to plan their activities for the week accordingly. So if tomorrow the AQHI is forecast to be 6, they might not decide to walk to work. They might take the bus, or perhaps they will decide to work out in the gym instead of working out in the park. So it's meant to be a self-assessment sort of tool. If you already have a pre-existing respiratory or cardiovascular condition, you're always looking for a change in some of the symptoms that you may be used to seeing. So for COPD, chest tightness, shortness of breath, wheezing, cough, frequent respiratory infections, lack of energy, swelling in legs, feet, or ankles, you're looking for things above and beyond what you would normally experience. For asthma, difficulty breathing, chest tightness, shortness of breath, wheezing, more frequent use of your quick relief inhaler. And these are things you're generally going to be experiencing when you're outside doing activities. If you have some form of ischemia, chest pain, shortness of breath, cough or congestion, extreme fatigue, difficulty sleeping, dizziness, fainting, heart palpitations, again, swelling in the legs, feet, or abdomen, and any form of arrhythmia, you're again looking for chest pain, shortness of breath, fluttering in your chest, racing heartbeat, slow heartbeat, dizziness, fainting, or near fainting. So with this, we're hoping that people will be better equipped to make adjustments to their own action plans that they have in place and manage their exposure to air pollutants better. Of course, not everybody wants to go online to check their daily AQHI, and for that reason, we have developed an AQHI app. It's available for free download. You can get it for an iPhone or an Android, and you're looking for a multicolored windmill type symbol for the Canadian Air Quality Health Index. If you want to download it on your computer, the Alberta environmental website actually has a link to the AQHI app on its website. So when you open the app, this is the first screen that you're going to see. It's the note page, and the note page icon is your home page. So this is the page that's going to display the AQHI for all of the cities that you've selected, and we're going to talk about selecting cities shortly. So here you're going to see the hourly AQHI for the city that you selected. If you select more than one city, you're going to be able to scroll through each of the pages, swiping across your screen or arrowing over. You're also going to see the forecast for today, tonight, and tomorrow for the Air Quality Health Index, as well as the entire scale, so that you'll be able to compare where the AQHI falls, like where today's AQHI value falls on the scale. And then in order to see the messaging, you just click on the AQHI value you're interested in, and a new screen will appear showing you the health information for the general population and the at-risk population. And you can exit the health information screen by pressing the back arrow at the top of the screen. The next icon is the map icon, and it's going to display AQHI values on a map of Canada. And it's interesting to see the spatial distribution of air quality across Canada. In this case, not completely unsurprising that in the northwest of Canada, the Air Quality Health Index is at a nice low 1, whereas in southern Ontario, where we have some major industry and big cities, the Air Quality Health Index is at a 4 in this example. You can use this screen to zoom in and zoom out, so you can actually just zoom right in on whatever location you're interested in. You can use the button at the top to toggle between the current AQHI value and the forecast AQHI values. And you can also use the bullseye to the right of the screen. If your phone has GPS capability, it will bring you to your nearest station from this screen. So if you push that button, it will automatically locate the AQHI reading for the nearest location to you. Now you actually select your cities using the tools icon screen. So on this screen, you can either select cities by scrolling through the list, and so this will be a list of all of the communities that have an AQHI available to them, or you can try entering the name of the location you're looking for in the community name box. If you want to select a community, you just click on the star, and any communities that you star will actually be moved to the top of the list. So every time you click on the tools icon, those will be immediately at the top of the list. The app has a really interesting feature in that we can set up user-defined push notifications. This means that in the case of, say, our asthmatic we were talking about, if they know that the Air Quality Health Index at 6 is an indication that they need to start taking action, they can set up a notification on their phone so that every time the Air Quality Health Index reaches 6, they'll be sent a notification. And you do that using this sliding scale. So in this case, the sliding scale was used to set the AQHI push value to 7. And then as long as the toggles are at the on position, so in this case, the toggle is on for Calgary, Anzac, Bathurst, and Beaver Lodge, so that for every city it's turned on for, anytime the Air Quality Health Index reaches 7, I will get a notification to tell me about that. The final icon, which I can't tell if it's a light bulb or if it's an eyeglass, this just gives you tips for taking personal action to improve air quality. And then I want to finish up talking about the AQHI+. So we discussed how the Air Quality Health Index, it's a national initiative, and it gives us nice uniform information that is health-based across the country. But we need to be somewhat flexible because it's a big country and different provinces may have different sources of concern for their air quality. So in BC, especially in the more rural areas, smoke from forest fires, from open burning, and residential wood burning are some of our primary sources of air pollution. And smoke contains a large amount of particulate matter with lesser concentrations of ground level ozone and nitrogen dioxide, and those two are common pollutants in an urban environment. However, the smoke episodes could be missed, potentially because the conventional AQHI particulate matter is a relatively small component of the conventional air quality health index. So BC, the province, has started an AQHI Plus program, which you will reap the benefits of if you go to the BC website, www.bcairquality.ca. The idea of this program is that When the 1 hour concentration of PM2.5 exceeds 60 milligrams per meter cube, the air quality health index value will automatically be bumped to 7, regardless of where it's at. So it could be at 2, but it will automatically be bumped to 7. And then if the following hour, the AQHI still exceeds 25 milligrams per meter cubed, the AQHI will remain at 7 for the next 4 hours, and then it'll be reevaluated. So it's like we're artificially elevating the AQHI, and that is just to take into account some of these episodes, such as forest fire smoke, that may not be captured by the conventional air quality health index, which is more sensitive to urban sources such as traffic-related air pollution. You don't have to do anything different to see the air quality health index. So when you access the BC air quality page, this is a screenshot of the page, and on the left-hand side you can see that there are a variety of things you can look at for air quality. There's Air Quality 101, BC's air quality readings, BC's plan for improving air quality. So here we've selected BC's air quality readings, and we have a map of different locations where there's an air quality health index, as well as a table. And the table has 4 columns, the first of which gives the current AQHI, and the next 3 give today's, tonight's, and tomorrow's forecast AQHI. So if there is an AQHI plus, the value in the current AQHI column will automatically be updated. So you can see at the bottom of the screen, at the moment there's an asterisk to remind us that if the AQHI index is increased to 7, it's usually because of high concentrations of smoke particles in this community. This, the AQHI Plus has been newly instigated, so they're still working on the messaging. But I think for now, there's nothing different that you have to do. You just go and check the Air Quality Health Index page and it will be updated for you. And that concludes my presentation today. I'd like to thank you for listening. If you have any questions, you can reach me at paula.smith2@canada.ca. And I've also provided the Environment Climate Change Canada website for the AQHI, as well as the website for the BC Ministry of the Environment Air Quality .ca if you're interested in the AQHI+.